Hi, I'm Bosca. I'm a sexual health nurse in Bendigo Community Health Services. Women's health services have been an integral part of Bendigo Community Health Services since 1985. In that year, a nurse-led family planning clinic and 4 sexual health doctors provided antenatal services, menopause and contraception options. At this time, Bendigo Community Health Services were not able to advertise services available to women as the existing local GPs thought the Bendigo Community Health Services would take their clients away from them. Our unique women's health services had the longest ever female GP. During the 1980s, an increased demand was for sexual health services, which included escort agencies, where the workers came for their 3-monthly checks and blue line certificates.
My name is Louise Holland and I'm a nurse practitioner with the sexual health team at Bendigo Community Health Services. In Bendigo, generally throughout the 1990s and 2000s, there were a few female GPs working in the specific area of women's and sexual health who bulk billed. BCHS was about to take off with their sexual health services for women and their sexual health and reproductive health services over the next 10 years. The development and implementation of the Well Women's Clinic at the central side occurred when an experienced female GP arrived, and our traditional family planning clinic continued at Eagle Hawk, and a youth health clinic ran out of our youth team. The sexual health nurses gained further education in sexual health issues, STI testing and treatment. By 2010, BCHS's women's and sexual health services were well established with advanced women's health care and management available at a bulk billed rate. In the last decade, these services have expanded to incorporate BCHS being awarded and funded as the first regional sexual health hub as state government initiative. And BCHS continues to partner with Thorn Harbour Health to facilitate the Loddon Mallee Regional STI BBV program with health promotion and health education activities at the heart. Our work also incorporates working with all our multicultural communities, and our nurses and GPs are experiencing working with LGBTI communities.
Our women's health clinic at Community Health has been here for 12 years now. When I came here 12 years ago, there was just one GP and one sexual health nurse, just for one half day a week. And the service we offered in those days was fairly restrictive in both hours and access to female GPs. In the initial days of the clinic, having restricted hours, there was often a 6-week wait for an appointment for a patient to come and access our service. Since those days, obviously, we've built up our service to now be virtually full-time, so our waiting time is very much reduced, and we're often able to offer appointments in the same week. With the increase in the services we provide over the years, we are now able to allow much more women to access the service in a more timely manner, and have increased our ability to provide that service to areas outside Bendigo that may have had very little access or no access to services in the past. We're privileged to be able to offer appointments that are probably a bit longer than most GPs are able to do, and we work as a team at our service, whereby our sexual health nurses may see someone initially in a timely manner and then triage them on to see the GP. We try to make the environment around our service friendly and open and non-judgmental. And this is a strictly confidential service. We work as a team, so we utilise our sexual health nurses to see people initially in some cases, especially young people that may feel more comfortable speaking to a nurse rather than a GP. As a GP that has worked in women's health for over 20 years, I find the the changes and increased accessibility that we're able to offer these days is very exciting. I've always been very passionate about providing women's health care that is easily accessible and empowering women to be able to make choices about their health freely through information and access to affordable and accessible services, and find it very exciting that these services are now available in Bendigo